my name's David Adams, and on behalf of the Waterloo-Cedar Falls Courier, I want to congratulate this year's recipients of the 2020 Nurses Awards. I want to thank our sponsors, Mercy One and Cedar Valley Hospice, without whom we wouldn't be able to put this on. And once again, I want to congratulate all the recipients of this year's 2020 Nurses Awards. Thank you.
Welcome everyone to this year's virtual Top 10 Cedar Valley Nurses Celebration. My name is Callie Richards. I'm the Senior Vice President of Patient Care, the Chief Nursing Officer for the Mercy One Northeast Iowa region that includes sites in Waterloo, Cedar Falls, and Owine. I'm happy that you were able to join us today. We've got a great celebration to recognize some outstanding nurses from our community. You may not be aware, but back in 2019, the World Health Organization actually identified 2020 as the year of the nurse and the midwife. And part of that was due to the fact that this is the 200th birthday of Florence Nightingale. And in addition, it was a way to try and perhaps increase our workforce. So I don't think the World Health Organization maybe had an idea of what was to fully come in 2020. It's kind of ironic when you think about it. This is the 200th birthday of Florence Nightingale. Many of our nursing staff recognize and identify who Florence Nightingale is. Florence actually was a nurse who back during the Crimean War helped identify infection prevention standards. So it's almost ironic that now here in 2020, we're also working with an infection pandemic. Some of those principles that she identified back in the Crimean War still hold true today. So nurses recognize her as kind of a founder of nursing practice. In my role as a Chief Nursing Officer during the pandemic, I sat on the incident command team. And what I did as the planning chief was I worked very hard to keep up on the CDC, the Iowa Department of Public Health updates, worked to come up with surge plans, made sure that we had equipment to support our staff, ventilators, PPE, that sort of thing. But I will tell you, the work that I did was pale in comparison to our frontline nursing staff. I saw wonderful acts of kindness, caring, compassion. It was outstanding how they all came together as a team. Today we're honoring 10 of the top 10 Cedar Valley nurses, and they are truly worthy of the recognition. So congratulations to them, and my sincere thank you to nurses across the Cedar Valley. Thank you for all that you do for our community.
Well, my name is Amy Ekstrand, and I have been a nurse for almost 21 years. I took a job shadowing at a local nursing home in my hometown of Owine, and absolutely fell in love with the residents in the nursing home just off of one 8-hour job shadowing day. Just getting personal with them on a one-on-one basis, and then helping them. Once you get somebody to trust you, then you can help correlate their care plan to help make them better and transition them to return home. And that's what I love the most about being a nurse. COVID-19 pandemic has been a learning experience for me as a nurse. I've always taken every illness very seriously, but this one's been a little bit scarier. Trying to educate the public about how important it is to really follow the guidelines that the CDC are recommending I'm very passionate about that. And I'm really not afraid to give my opinion about it when people ask me. So it's definitely been life-changing.
Hi, my name is Betsy Smith. I am a nurse here at Allen Hospital in the Birthing Center. I've been a nurse for 24 years and I've loved every minute of it. I love that it's a constant change. I love that we have the ability to exceed expectations, to make the best day truly the best day, or the worst day the best day it can be. COVID has brought, obviously, so much to our world. And to nurses, it's brought a sense of uncertainty, a sense of strength, a sense of anxieties, a sense of you didn't realize that you could accomplish what you could accomplish in such an unknown territory. Our moms and our families have been affected by the uncertainty and the inability to have that social interaction. So when they walk into Allen Hospital, We are their support people, we're their family, we're their friends. Think that when that new nurse hits nursing school and they have no idea what's going to hit them, and they come to us and they're, deer in the headlights, and we can just take their hand and say, come on, let's show you. And when they see something or feel something that is so amazing, that is what's worth it. And then to see our new nurses succeed, and to see that we are going to continue to grow our profession as nurses is pretty cool to me.
I'm Cindy Moody, and I'm a registered nurse and have been a registered nurse for 38 years. Well, my nursing career began when I was about 10 years old, and that's when I became very ill and actually had the Hong Kong flu, which at that time was also a pandemic. I had an experience in the hospital that was not a good one. When I got older, I was going to be a nurse and make sure that people didn't experience those bad things when they're in the hospital. Being a nurse, most of the time you are not realizing the impact you're placing on them in the moment. I quite often have people comment on how much I work because I work full-time here, and then when I fill in at the nursing homes, they ask me why I work so much, and I said because I love my job. It's not a job, it's a career.
I'm Juanita Williams. I'm a family planning nurse at Allen Women's Health. That's a part of Unity Point, Allen. I have a bachelor's in psychology first. I love working with people and understanding them better, and I felt like I needed additional skills in helping people, and to be able to understand them in body, mind, and spirit felt like a supplement to my psychology that has given me a lot of different opportunities to help people in a lot of different ways, sometimes more direct and practical ways. I love feeling like I make a connection with the patients and make them feel respected and cared about, that their unique needs are my first priority, and just to make a difference in that moment. Well, I think wearing the masks has been really difficult because so much happens with facial expression. But I feel like it's really been a thing to work toward understanding that this is really important for me to do this for others and get past my own concerns about what it does to me, because I'm here to do my best for the patients, and that's number one, protect them from me. So I need to wear a mask.
Kim Wilby. I'm an emergency room nurse at Mercy One. I didn't become a nurse till later in life. I actually had my own health scare, and at that time had tubes and lines coming out everywhere. Felt very much like a non-human. And I had the care of one particular CNA who came in and gave me a bath, even shaved my legs, made me feel like a real person again. And at that point, I knew it was time to learn how to give back. It's the people interaction, kind of meeting people at maybe the scariest moment of their life and being able to hopefully get them on the path of health and well-being, but even if that isn't going to be the outcome, just being there for folks. I think I'm blessed to be able to have found my calling. It doesn't feel like a job. It feels more like a mission. So if you get to do something that you enjoy, the saying is you don't work a day in your life. So I'm very fortunate.
My name is Lori Walker. I've been a nurse. This is my 32nd year. And I have worked for Mercy One the whole time that I've been a nurse. My father was a health and phy-ed teacher, and I began reading his first aid books when I was in 3rd grade, and so I've always kind of had a passion for knowing how to take care of things in a crisis. I like being the one taking care of them at a most vulnerable time of their life, and trying to make what seems pretty horrible maybe a memorable time for them where they have become friends with the people caring for them, and educating them so that no matter what's going on with them, they feel like they have control over the outcome of that.
And how has COVID affected your job?
Well, I was scared at first, and I talked to my medical doctor and said, should I be working because I'm retirement age? And she said this would be a good time to retire. And I really like my job, and I really felt like, how could I desert my population of patients at a time when I'm most needed? So I decided not to worry about what I didn't know was going to happen, and the hospital provided us with the stuff that we needed to protect ourselves. And the visitors not coming has been difficult because as a nurse, you're their care provider, but you had to be their cheerleader, you had to be their friend, you had to be their confidant, and so you took on more of a role.
Hi, I'm Sammy Bergman. I have worked with Mercy One for 5 years with podiatry and family practice. I became a nurse as it was always kind of a dream for me since I was a little girl. My parents always pushed me to do what I was passionate about, and that was helping others. And so I pursued it with becoming a CNA first, and I knew I loved working with geriatrics. And I worked geriatrics, but it wasn't for me. And I started working with Dr. Bremner at podiatry, and it kind of just fell in my lap, and it grew from there, and I love it. I know that sounds weird, but I love working with feet because I still get to work with my geriatric patients, but then I still get to work with kids and patients of all ages. A lot of the patients my provider and I see are geriatrics, so they're hard of hearing. With the masks and the inability to do the high fives and the handshakes with our patients, it's hard for them to hear me, for one, because the masks muffle us. Being a nurse is something that it's a feeling like no other. It's hard to describe. It gives me extreme care knowing I can help one person that day. Makes me feel like I have made a difference in this world.
My name is Tara Sheets. I'm a pediatric nurse for Unity Point at Home and the pediatric unit at Allen Hospital here in Waterloo. I would say the biggest thing for me that I love is just the smile that I get and the love that I feel from the families that I'm able to help, or able to help them get through a difficult time in their life. Well, COVID has impacted so many things in our lives, and it just naturally carries over into my job because of the healthcare field. It has impacted the way I interact with my families. I'm not allowed to let siblings come up and give me hugs. I'm not allowed to give them high fives on the way out the door, and all of that has to happen from a distance, which is difficult sometimes for young children to understand. My job entails me to go into a home and visit a family in their natural environment. And so when I get the opportunity to do that, it offers me a different look into someone's life, and it offers me a different way of being able to help impact them in their overall day-to-day activities versus just a small piece when they come into the hospital. And so it has given me a different perspective and a newfound love for a different aspect of healthcare and nursing, by being able to go out and really impact the community as a whole and not just within a hospital setting.
So my name is Teresa Evans, and I work at Mercy One in the PACU. I became a nurse because I wanted to help people. I felt compassionate towards people. My mother had wanted to become a nurse, but because of scoliosis in her back, she was told she probably couldn't. And so I kind of fell into it that way. I love being a nurse because I can help people. I can show them compassion in a spot where I work in recovery room. We have to be the patient advocate for the patients that we deal with because they're coming out of different stages of anesthetics. I'm getting towards the end of my career, and it's sad in a way. I'll probably retire in a couple of years, but there's still lots of things that I want to do out there in the community to help. So things I currently do, like I'm a wildlife rehabber, and I do a lot of education on the phone with people with wildlife and any zoonotic diseases, things along that line. It was tough during the COVID times because there were there were changes daily and things that we needed to do. But I think we came out very well. It made me maybe even a more compassionate nurse. It's hard when you've got all that garb on to feel like you can be as close to the patient as you want to be. But I think we did well in doing that for the patients.
Hi, my name is Wendy Bass. I'm a licensed practical nurse and I work for Friendship Village in Waterloo. What brought me into nursing probably was when I was younger, about 18, my dad was dying from terminal lung cancer, and me and my stepmom became his caregiver, and I think it taught me a lot about the importance of nursing and the education from nursing and the help nurses bring and how essential that is in our world today. I work in long-term care. I'm so fortunate that I get to know my residents really well. I get to work with the same people every day, which is such a blessing for me. I had a resident this last weekend say one of the most validating things to me probably I've ever received in my career. He likes to joke and has this kind of banter how I'm his favorite nurse, and his daughter was visiting and she said, you know, Wendy, he asked me if I knew who his favorite resident was, and I grinned and looked at him and I thought for sure he would say him, and she said no, he said it's whatever resident you're with. That's your favorite. To me, that was extremely touching. The COVID, that's kind of changed our routine like it has for everybody in the world. You know, we have the usual, have to get health assessments when we come in, and we're quarantined. And so it's very hard on the residents and families, which I can kind of relate to, because as a mother and a daughter, I can't imagine, you know, not being able to hug my loved one and see my loved one. But I'm also a firm believer that we will learn to love a little harder and hug a little more when this COVID is over with.